Hey everyone, good evening. This is Dr. Sullivan with you. I am here to talk about an incredibly important topic. Maybe it is very important for you or a loved one. We are talking about strokes tonight, specifically the term brain plasticity, neuroplasticity after a stroke, which essentially means recovery at the cellular and functional level. And you need to understand exactly what people mean when they say that term, and how is it that you can do everything you can within your power for your own recovery or somebody that you care about, so you can squeeze as much as you possibly can out of this recovery. I am going to tell you who I am tonight because I often forget to do that. And it's not just here on Facebook. When I go out and do talks, I get so excited about the topic that people often come up to me after and say, boy, you seem like you know what you're talking about. I wonder if you're a doctor. So indeed, I am Dr. Karen Sullivan. I am a board-certified neuropsychologist. I am very proud of that fact. I wanted to be a neuropsychologist for a very long time and went through an undergraduate program, my master's, my PhD from Boston University, finished my training at the Boston VA through Harvard Medical School, and then you finally get to the board certification process. It's the gold standard for what I do to show the public that they can trust me as an eminent expert in the field of brain and behavior. I love neuropsychology because it incorporates the whole person. We never just look at a brain problem through the lens of the brain. We always try to look at it through the lens of the person who is having a brain problem. I have a private practice in Pinehurst, North Carolina. Before that, I was on the faculty at UNC School of Medicine in the Physical Medicine and Rehabilitation Department, and I was in charge of the inpatient stroke unit there and did a lot of work there. So I have a good background with stroke, I feel like, and really why I'm here with you is to fill a gap. And this has been painfully apparent to me throughout all of my training, even up to the present day. But something happened to me a few months ago while I was on vacation at the beach, just for like a 3-day vacation, and I was looking at some Facebook groups. There's one specifically called Young Survivors of Stroke group, and I was so outraged and touched by the lack of knowledge about stroke, the lack of knowledge about neuroplasticity, and the only way I could go to sleep that night was to vow that I was going to try to be the voice of high quality education and treatment recommendations about stroke. And I thought what I was going to do was to write like a 2-page PDF talking about the 3 principles of neuroplasticity that I would just give away and kind of disseminate throughout the internet. Well, what has happened is this has grown into a rather large project that is kind of starting to feel like a book. Right now it is about 100 pages, and we are hoping within the next month to have it out for printing. It has now become the 10 Rules of Rehab. We're calling it the Interactive Stroke Recovery Guide, and my hope is that it provides really clear, compelling explanations of maybe why you had your stroke, where you had it, and what that's going to mean, how it impacts so many aspects of your functioning. We often forget that stroke has so many effects, not just physical. There's a disproportionate focus on the physical because we can see it, but of course there's many other areas that are impacted. But really, what are the principles, the rules that if you just understood that you could apply to any of your therapies, any activity during the course of your day can be turned into a therapeutic activity if you just understood the principles. So I'm working fast and furiously on this, and what I'm going to do tonight is get a little bit into some of this content, and I need to do it in part 1 and part 2 because it's just such a dense topic and I don't want to short shrift you guys at all. So the first thing that we have to talk about is how long is recovery? Well, my goodness, it is never ending. If you have had a stroke, you will be recovering until your last breath. Surely in the first 3 years, I think of the soil of the brain as kind of being its richest. It's got the most nutrients and vitamins in it to support the strongest peak of recovery, but the reorganization of your brain, the adaptation of your person is going to go on and on and on forever. So really what that means is there's always an opportunity to either truly get better at the functional level, do a task better, or to adapt better. This is such an important psychological concept that we have to bring into the discussion. I am an optimistic realist. I want all of you to get an absolutely full and robust recovery, but the truth is, there's some strokes that people cannot recover fully from, and that's where psychological adaptation, support, figuring out how to compensate, do things differently comes in. So to me, stroke recovery has to be made up of two parts. So we do want to talk about cellular recovery, how to get those brain cells back to working and regenerating. We're going to talk about that. But we also have to talk about compensating and adapting. These are very important concepts. There are factors that influence how well somebody will recover after a stroke, and I figured you'd want to know these. Well, the first one is people that are very young and very old tend to do the worst, okay? So what we think that's related to is when the brain is not quite strong enough or has lost some of its strength. So kids, babies some babies have stroke in utero, they tend to do very poorly, and the older you are, unfortunately, the more poorly you seem to do. But in the middle, what really seems to be a big factor is the overall physical, cognitive, and mental health of the person at the time they had the stroke. So the healthier you are physically, the better you can do. The healthier you are in your brain, the health of the rest of your brain. Remember, a stroke is always a focal injury, whether or not you've had one specific stroke, or some people have multiple strokes. But a stroke is very rarely the entire brain, and that is a key concept to remember, because we want to bring in the strengths from the rest of the healthy brain to compensate for the weaknesses. And this is where neuropsychology can really help you, and you know that's one of the things that I want to promote in being with you, and we'll get to that in a little bit. The next thing is how fast someone got to medical care. Unfortunately, was someone in another country? Did they not have access to acute care to get to the hospital if they had a blockage? Did they not have access to the TPA that can, the clot busters? The intensity of the acute rehab that the person gets in the immediate aftermath is very predictive of how well people do in the future. Now, that's not to say if you didn't get intense rehab immediately that you're not going to do awesome, because you could. It just means that those people on the whole statistically tend to do better. People who have good financial resources do better. We have to be real here. These people probably have better insurance. They can keep going with therapy after the insurance says you've worked through your 8 sessions for the calendar year. Social support, how many people do you have rooting for you around you? That's very important. Do you develop something like depression or anxiety or post-traumatic stress? Those things are brain-based issues. So now you don't just have a stroke that's negatively impacting your thinking or your moving or your swallowing or your moods. You also have depression on top of there. The next one is attitude, and you have a lot of control over your attitude, feeling like you want to observe the micro victories, that you are looking for successes and not looking for ways that you can't do things as well as you used to. And the last one is access to information, and that's the piece that I think I can do something about. It really, really bugs me when people come to see me and I know they've had a stroke, and they tell me, I don't know where I had it, I don't know why I had it, I don't know if this symptom I'm having now is related to the stroke. So that's one of the first things we have to do, is really fill in the gaps for people of their knowledge. So yes, in these first few years, there is a lot going on, but remember, never-ending recovery. I think that's very important that you know that. So one of the first steps that the brain has to do after a stroke is a clearing out process. It's like spring cleaning. So whether or not you have had a hemorrhagic stroke, which means that you had a burst blood vessel and you have too much blood in your brain, or you've had an ischemic stroke, which means you had a blocked blood vessel and not enough blood got into the brain, there is a lot of debris that is left behind from a stroke. So basically you've got either the blood from hemorrhagic, or in the ischemic, all of the brain cells that didn't make it, the neurons that died, they release content. They don't just evaporate, okay? They have stuff that lives inside those cells that is then released. The skull is a very finite piece of real estate. There's not a lot of room for extra anything up there. We have our brain, we have the coverings that cover the brain, and then we have cerebrospinal fluid, which lives kind of in the middle and in these different pockets. Beyond that, the brain does not really want any new tenants. So the number one thing that it has to do is munch away all of this debris and get rid of it. This requires that the immune system, which we now know we have two, we have one in our body that fights things like colds and flus. We also have a specialized one in our brain. It's so amazing. And the way that this immune system can do its job the very best is when it is focused. And the time that it can focus most is during the two deepest stages of sleep. This is why the critical thing for you to know about stroke recovery is that it is a twofold approach. It has to be intense, repetitive activity during times of the day, coupled with restful, quality, long-term, uninterrupted sleep. You might be tempted to want to go with your rehab, but I want you to understand that good, high-quality sleep is just as therapeutic as all of the intensity of the doing and the trying. You have to couple the two things. There is no doubt about it. So the first thing that I really want you to do is truly believe this mantra that knowledge is power when it comes to stroke recovery. If you do not know the kind of stroke that you've had, where in your brain you had the stroke, why you had the stroke, and there are the top 5 reasons are high blood pressure, high cholesterol, type 2 diabetes, atrial fibrillation, and arterial dissections. Those are the top 5. You may be in there. You may have another reason. They may not know. There's plenty of people that unfortunately medical doctors cannot pinpoint exactly why they had it. But what I care most about is that you have thought through, even if this means on your own, all the different ways that your stroke has affected you. So remember I said before, it's so easy, and medical doctors do this all the time, to just focus on the physical. And this is why the stroke guide that we're working so hard on is interactive, because you have got to personalize your knowledge. And you need to go through all the domains and figure out how exactly has this stroke affected me, because that's your map for recovery. If you don't acknowledge what has changed, we really don't know where it is we're supposed to go. We don't know where the exits are. So this is where an assessment is absolutely critical. So the areas I want you to think about, and you can even get a piece of paper and make little lines. You can wait till the stroke guide comes out, but get to thinking about this stuff. The first one, physical, okay? There's a lot of focus on that, so I'm not going to talk about that one too much. Next one is sensory, taste, smell, feeling. Then we have cognitive. This is the thinking, processing, memory, language. Then we have behavior, maybe being a little impulsive, reacting too quickly, not reacting enough. Then we have mood, too many moods, too many emotions, not enough emotions, kind of goes either way after a stroke. Let's face it, there are financial symptoms that happen because of a stroke. Medical bills, not being able to work, you can't get disability, it's very stressful. Then there's the social impact, right? I don't think people understand enough about stroke, and many times people will tell me it feels like an invisible disability. People don't get it. They don't see the fatigue. They can't see the frustration. They can't see how I get overwhelmed, and it's painful when you don't feel understood. That's a very basic human need. And then there can, of course, be an impact on intimacy, how we physically and emotionally connect with other people. And that can be your interest, your performance. It's just not the same as it was before, and that's really hard. The second thing is I want you to assemble the very best care team that you can. So if you were with me last week, you might recall that we focused on respectful communication between you and your doctor really taking a we can, we will attitude, right? Really partnering with you in their compassion and their expertise, not seeing themselves as the expert, but seeing that they have a specialized form of expertise, but that so do you and so do your loved ones. And true care happens when these two brilliant minds can come together and figure this out. So I really wish for all of you that you have care providers that truly partner with you. And I know that a lot of this is in a perfect world, and that access is key, and where you live in the world matters, and how much insurance you have matters, and if you have a car. But really what I want you to do is get the very best team that you can possibly get and encourage them to communicate with each other about how you're doing, because those people do get the very best outcome. So the people in a perfect world that I would love on your care team are, of course, a neuropsychologist, and I'll tell you more about what we do in a minute, a neurologist, a physiatrist, which is a rehab doctor. Very important to have orthotics involved. These are the gear people, they do the braces, this stuff to help you with movement. Physical therapy, of course, occupational therapy, speech and language therapy, which I think needs a name update because they do so much more than speech. They can do swallowing, they can do a lot of different types of communication. The next one is a massage therapist. I really think that there's a place in stroke recovery for somebody who helps your body relax, your muscles get stimulated. Family and friends, these are parts of your care team, and for some of you, they're all you have. So we have to talk about how to appreciate these people, how to make sure that they know how much we need them, and how to communicate to them what it is we're really going through. But again, remember, I'm an optimistic realist. So the truth is, you may not have any of these people. And then you know who it comes down to? It comes down to you. You may be a care team of one out there. And really, it's those people that I think I do a lot of this for, because maybe the best you have is Facebook and you are out there seeking this information. And I want to make sure you have the very best that you possibly can. So I would love to know if any of you out there have seen a neuropsychologist, and if you have not and you are a stroke survivor, I personally feel like it is your right to see one of us, and I would love for you to advocate for a referral with your primary care doctor, your neurologist, your rehab doctor, because what we do is really a gold standard evaluation of all your person, all your functioning, and we give you that map. What exactly has changed? What are the strengths and weaknesses? We're also really good, I think, at giving education. So many people I know just want answers. I just want to know what happened to me. And in the face of no information, anxiety can get really high. So many people with stroke fear having another one. This is where a lot of information is really lacking. We're really good at getting together treatment plans. We can help communicate with your family. And how we do our magic, what we do is through very long assessments. Some of it involves you, and you're with us for an hour-long interview, 2 to 3 hours of paper and pencil testing, and an hour of feedback. And other times, a lot of hours happen behind the scenes where we're getting medical records and we're talking to doctors. And I truly believe that we can provide you with the most comprehensive post-stroke care that you will be able to get in our medical system. So let's transition a little bit more to the specific topic that we're here to talk about. So this is brain plasticity after a stroke. And there are 3 types of recovery that I want you to know about as we start to think about this very important topic. The first one is repair at the biological level. So this is when new brain cells or parts of brain cells can actually regrow and return to function. So this is like why people do their hand strengthening exercises with the stress ball over and over and over and over again, because they are literally carving a new neural pathway between the hand and the brain. So after thousands and thousands of repetitions, we may actually be linking together little brain cells that now can form the thread to make the action of moving the hand from the brain to the hand actually happen. So there is cellular recovery, okay? Another type of recovery is learning to compensate. So this might be like using a non-injured part of your brain to take over something another part of your brain used to do. So we can do this by relearning, kind of rerouting things in the brain. We can do this by using external strategies. So for example, if you have memory problems, you can now use a calendar, you can use a schedule, whereas before maybe you could keep it all in here. A doctor, a care team, your friends and family, they can teach you how to do things a little bit different in the external world to compensate. And the third type of recovery is acceptance of the changes, changing your expectations, redefining what you consider to be success, focusing on the strengths, not the weaknesses. It's really all about an attitude. So an example there might be being okay with tying your shoe with one hand, being okay with wearing cool new Velcro shoes, right? It's all about how you look at it, how you label things. All of these 3 types of recovery require neuroplasticity. So let's define that term. What exactly is it? Because really, that term is the star of your whole recovery. It is your co-star. What it really means is that our brain and our cells have the extraordinary ability to reorganize, to grow new connections after damage in the brain and actively compensate. Isn't that absolutely amazing? Because remember, even 20, 30 years ago, they thought once a brain cell was damaged, that was it. Bye-bye. You are not going to see that thing anymore. Then they started to say, okay, maybe after a year of a brain injury, then you're going to get recovery. Now they seem to be saying 2 to 3 years, but really good brain doctors know it is never ending. There is always time to return to rehab. There is always a reason to get remotivated to engage yourself in your recovery. So to understand neuroplasticity, though, you have to understand how the brain is organized, because this is key. The brain is organized into countless interconnected networks through very large areas of the brain. So if you could take any kind of a task, an apple even, okay, there are nodes, neurons in the brain that represent different parts of apples that don't just live in one little part. This is spread in a distributed pattern across the whole brain. Remember, you got to have the different colors, what kind of trees they come from, the smells, the memory of the apples, maybe with your grandmother, different recipes that you have that call for apples, right? This is all over the place. So this gets back to strokes being a focal injury, okay? This is key. So stroke happens in one area specifically, but the network that is damaged is really very wide. So our job after a focal injury like a stroke is really pretty simple. It's rebuilding the network, and those are the principles that you need to understand, because once you get them, you can apply it to every single thing you do. You can apply it to how you brush your teeth. You can apply it to going to your physical therapist to squeeze as much neuroplasticity as you possibly can. So the thing you also need to know about neural networks is that they are established very slowly, many years. There's a lot of life experience that goes into building them, and the things that are our passions, that we are emotional about, seem to get laid down the strongest, okay? So you can kind of think of the brain as, a building that's kind of had like a hurricane. So the foundation of the neural network is almost always still there. But what we have to do is rebuild some of the walls. We have to get in some more structure to reconnect the whole building so it can be sound and safe, okay? Now, I do want to say, though, this is not always the case, because there are times where there's so much damage, let's just say in the occipital lobe, the visual part of the brain, where the whole network for, the right peripheral vision has been damaged, and no matter how much somebody tries in their rehab, you just can't get enough of the network back to actually get the function back. So what I'm talking about here are principles. It's not the case that, there are some instances after stroke where no matter how hard you try, I am sorry to tell you, the recovery you need to focus on is the adaptation. And this is where the assessment comes in. So you kind of need to know, how realistic is it for me to keep pursuing this goal, or should I be trying to kind of reroute and adjust, right? But either way, those are two active ways of being in your recovery. So the idea is that there is a process by which these new nodes, these new neurons can grow, and this is called axonal sprouting. And this is when undamaged brain cells can either grow new nerve endings to latch onto ones that were there before but maybe did a different job. So what we need to know, the key here is, well, how do we promote this axonal sprouting? How is it that we get these new little nerve endings on the cell to link up with one that might kind of be geographically far away? So it goes back to what I said to you before. It's a combination of intense repetitive activity, which you think of as your rehab, in combination with high quality rest, specifically deep sleep. The two of those actions back and forth are going to get you your very best outcome. So what we call this in the world of brain science is an enriched environment, and this has been proven time and time again with rats. And what they do is they basically give a rat a sham stroke. So they take a little electrode, and it's kind of sad, but they give a rat a stroke. And then they do all sorts of experiments on it and look at their brain cells and see what the differences are. So about 20 years ago, we knew if you put a rat who's had a stroke in an impoverished environment, meaning no other rats, very low stimulation, boring food, same thing, day in, day out, no change. When you look at their brain cells, they will have impoverished brain cells. They're very weak and they're kind of spindly. The rats who've had a stroke that you put in an environment with other rats, with wheels, with changing up their food, with taking them out and playing with them, they have these really robust, enriched brain cells. And I think that that is a good experiment to bring up to you guys, because I want you to think of not think of yourself as a rat, but think of your environment as needing to be enriched, not just with amazing foods, not just with social health, not just with cognitive stimulation, but what science tells us is you need all of that coming together to really give you the healthiest, strongest brain cells that can regrow and regenerate. So it gets a little more complicated than this, because there's actually a chemical, a hormone in the brain that promotes this sprouting that we so desperately want to encourage after a stroke. And these are called neurotrophic factors. Now, these are molecules that are made in the brain, and really they have a couple different jobs. The first one is they literally grow those little sprouts, the dendrites that we so desperately want. They also increase something called glia in the brain, which you can kind of think of it like specialized connector cells. These are kind of like the support for brain cells that remove a lot of that gunk and that debris, but they also provide like structure. It's kind of like maybe some support beams in that house we were talking about that had the hurricane. And also these neurotrophic factors strengthen blood cells. So who doesn't want more of these? So the question you might be asking yourself is, well, can I just take a pill for that? And unfortunately, no. There have been several failed late-stage clinical trials, unfortunately, where they had some promising drugs, but the problem seems to be we cannot get them past the blood-brain barrier. So really our body and our brain are disconnected by this thing called the blood-brain barrier. And the idea is it's kind of like a lock and fit little junction that really protects the brain. And it's an adaptation through evolution to keep bad, dangerous molecules that might be in our body, like a virus, out of the brain. Now, it doesn't always work, and that's how people get things like meningitis. But for the most part, it does a really good job. Now, this becomes problematic when we want drugs that we take through the mouth that get digested in the stomach to actually get up to the brain. So we're still working on that, and I want to tell you some of that research. But the closest thing we have to a pill that you can take to grow these neurotrophic factors is Prozac. And we've talked about this before, that there was a series of studies called the FLAME trials, where they took people who had had strokes, and these people did not have depression at all. They all had a very similar injury, and they were left with one hand that was not very functional, wasn't working very well. And they gave them all Prozac. They gave half Prozac and they gave half like a sugar pill. And the folks who took the Prozac got more recovery of their hand back. Their hand was more functional at the end of the clinical trial than the people who had taken the sugar pill. So this changed the way we think about antidepressants, that it's not necessarily correcting a chemical imbalance, but depression actually physically injures brain cells. Not at the level of a stroke, but it certainly does do damage, probably because of the high level of stress hormones that can be involved with depression. So the idea for me is that I always want to make sure we do a good assessment for mood, because imagine now, not only have you had a stroke and you're getting a not so great environment for brain health and recovery, you also maybe have depression, which is kind of giving you a double hit. So there are some other things that you can do, and I know, that's really why you're here. You want to know, how can I improve my recovery? The only other things that have definitive scientific proof are intensive exercise and those 2 cycles of deep sleep, so REM sleep and non-REM sleep. A lot of work is being done now in the field of neuro rehab with Parkinson's disease, really showing that intensive, consistent exercise 3 to 4 times a day, 45 minutes to 60 minutes, is really keeping people stable with their movement disorder, and there's a lot of promise there. It hasn't quite moved over enough to stroke, but the idea in brain science is that once a principle is established, even in an animal or in another disorder, that it will generally apply to other brain disorders. The other thing we know is what you put in your body has a lot to do with the release of these neurotrophic factors, and the MIND diet has been shown in depressed people in 2011 to increase these inborn brain growth hormones. So we haven't quite got to stroke. We know that the mind diet does help reduce the instances of cognitive disorder, including vascular dementia. And when we're done, I'm going to post a article that I've written showing you how to follow the mind diet. It's the Mediterranean Intervention for Neurodegenerative Delay, and I like it because it's practical. It's not a strict diet, it's very common sense, it's whole foods, and the idea is it's low sugar, low simple carbohydrates, good fats, high quality proteins, these kind of things. The other thing we think is that sugar actually reduces these growth hormones in your brain, so you want to avoid processed sugar especially, and that good fats seem to increase it. Now here's the problem. We do these research studies, and like one, for example, 2015, we gave folks some omega-3 fatty acids in the form of flaxseed oil, so 3 times a day, 500 milligrams for a week. And at the end of just 1 week, the people in this study had higher blood plasma levels of this growth hormone. But the problem there is we can't get into the brain and figure out, does the amount of growth hormone that's in the blood translate to bioavailability in the brain? So it's preliminary evidence. I personally would take omega-3 fatty acids if I had had a stroke, and what it looks like is that it seems to be a more powerful effect in women. So that is very important. What I want to do now is talk to you a little bit about those 5 rules of rehab. So remember, in my stroke guide, I'm working really hard to figure out the top 10 most important things. So tonight, just really quickly, I'm going to go through the top 5 with you. First one is everything starts with an assessment. You do your job of figuring out your symptoms in all those domains I talked to you about, and you go to your doctor and you advocate, why is this happening to me? Where exactly do you think I am with this? We do this all the time with things like strength and coordination. Why can't we also do this with mood issues, with processing speed issues, with irritability? I mean, it's all a brain-based issue. It's very easy sometimes to think the more mood and behavior symptoms are more the person, when really it's the same brain area that's causing the hemiparesis in the leg, right? So we need to be a little bit more progressive and inclusive when it comes to different stroke symptoms. So I want you to think about getting the very best assessments that you can, which is your starting point, right? So if we're gonna ask you to go on a recovery journey, I have to tell you the place to start, right? You need to know on your map, this is the entrance into this big adventure. The next one is it's very important to make rehab personalized. So how you're going to do this is by building on what is familiar and what is emotional for the person. So remember, I said what we're really in the business of doing is rebuilding brain networks, and that these are long-standing and based on our life experiences. And the more emotional we feel about something, the more emotional we're sentimental, we're connected with something, the stronger those connections are going to be, the more likely that they are going to be to have the strength to kind of rewire and reroute themselves. So I want you to incorporate anything that you love, a family member loves, into rehab. This can be the love of a sports team, the love of a pet, someone's competitive spirit. You have to really think about their specific spirit, their personality, and bring more of that person into their recovery. If you go to do your physical therapy and it's just kind of rote and it's, cookie cutter and one size fits all, you're not going to get as much out of it. So if you love someone with a stroke, make it fun, make it interesting for the person. I mean, wearing the sports team shirt, setting up I was joking with someone earlier today, if I was in physical therapy, you could put a picture of John Bon Jovi at the end of that walk, and you better believe I'd be hustling down there. So you have to find a way to get the person's senses involved and to really make sure that their care, their outreach is very customized for them. The next rule is repetition and consistency. The truth is our brain masters whatever it is we do more of. So you want to sit on the couch, you're going to become a great couch warmer. But if you practice those speech exercises every day, your speech will in time get a little bit better. You have to pay attention to what I call those micro victories. Recovery from stroke in the beginning is more likely to happen in leaps and bounds. Over time, it becomes a snail's game. It's very slow, but it's happening if you just fine-tune your mental focus on the little tiny baby steps. What research supports is 2 hours a day of repetition in your rehab, with the exception of constraint-induced therapy, which is, if you have paralysis on your left arm, constraint therapy would tell you to take your right arm and put it in a sling and only be able to use your left arm all day long. It's intense, but it works, and they recommend that people do 90% of their waking hours. The next one is to harness the power of your mind. Please do not forget that a stroke happened to an organ in your body, your brain. It did not happen to your mind. It did not happen to your spirit. And these are two very strong things that you can utilize to jumpstart your recovery, and that you can really use to help you go the extra mile when your body and your brain are tired. So I thought this was a really cool research study to tell you about. So research has told us that even when people imagine doing a rehab therapy, let's just say like squeezing their hand, even the imagining is activating the same part of the brain as would happen if you actually did the movement. Okay, so what this means is that visualization and mental imagery, imagining yourself talking fluently, imagining yourself in a better mood, imagining your body being coordinated, that the power of your imagination is a huge untapped resource, and we really need to incorporate this more into stroke therapy. This is really the science behind things like mirror box therapy, which we know absolutely works. You're kind of tricking the brain visually into thinking that an appendage works better than it does, and over time you give your brain a contradictory message, and you are going to get more function back. And the last one for today is prioritizing sleep. I know I've talked about sleep before, but it's very important in our stroke conversations because more than half of stroke survivors either sleep too much or sleep too little. The key with sleep is you want continuous uninterrupted sleep that takes you through the 5 cycles. So we've got stages 1, 2, 3, 4, and 5. 4 and 5 are deep sleep. So we have 4 deep sleep, 5 is REM sleep. And you can't skip 1. There's no jumping around. You got to be in 1 to 2 to 3 to get to 4 and 5. So this is why it's critical that we help people with stroke sleep for long amounts of time. These are important stages because of that immune reaction. This is when the immune system can turn other things off and really be able to focus and restore getting that debris out and helping the connections come back in. The other thing that happens when we are in deep sleep is that our frontal lobes and our memory centers review tapes of the day over and over and over again and decide ultimately what is important to put into long-term storage of memory. So really, deep sleep is like free physical therapy. It's free occupational therapy because everything you do in your physical therapy is getting rehearsed over and over and over again. It's also free emotional therapy because we process traumatic memories during deep sleep. So there's every reason to validate and to protect the sleep of people who have had strokes, especially in the first few years. Now that being said, there's some folks who have neurofatigue and all they want to do is sleep. And in those folks, it's important that we kind of push them the other way and get them in more of an active daily schedule and pattern. If you haven't seen my talk maybe about a month and a half ago, 2 months ago on neurofatigue, please go back and watch that one because it addresses that issue specifically. So that was a whole lot of information coming at you tonight, but I think you guys are thirsty for it, and you can always watch it again. I also know that I can talk kind of fast when I'm excited about something, and you got to imagine these ideas have been in my head for a couple years now, and every time a patient comes in and they say, my God, if I only would have known this 2 years ago, this would have changed my recovery, or do you know how much my family has suffered because they don't understand that my irritability is a part of my stroke, and it's not that I'm mad at anybody. So there is healing to be found in this information, and that's why it's so important to me to be here and why I'm so grateful that you give me your time and attention with these lectures. So I am actually going to be doing a lecture in person up in Durham in North Carolina next Wednesday. So I'm going to take a week off and we're going to play a replay. But in 2 weeks from now, I'm going to come back with you and give you my 5 other rules for brain plasticity. And I want to answer any of your questions. So if you want to leave a question for me down below in Facebook, I'll make sure I do my best to incorporate it next time into the lecture. I hope that you guys found this helpful. I really love doing this, and I'm very happy to be here. So have a great night, and I will see you next time. Bye-bye.